From the Einstein Healthcare Network studios in Philadelphia, this is Health and Wellness.
Hello everyone, I'm Genaye Channel with my co-host, Dr. Andy Rosenzweig, Division Chief and Fellowship Director of Geriatric Medicine with Einstein Healthcare Network. And this is Aging Gracefully. Our topic is how to prevent falls, so let's get right into it. Why are the elderly more prone to falling?
It's a combination of both internal and external factors.
Okay.
As we get older, our balance centers are off a little bit. Our vision is sometimes impaired.
Yes.
Changes in blood pressure tend to slow down such that when we sit up or stand up real quick, not enough blood gets to our brain. And then there's a lot of external factors. All the medications that are prescribed often have lowering blood pressure or gait imbalance as a side effect. The environment that our older adults often live in, with wires strewn across the floor, or shag carpeting that tends to move, or bathrooms that aren't fitted with bars and other safety devices. So all these factors tend to culminate in an older adult placing them at higher risk for falls and at higher risk for injuries related to falls.
So do you have any advice out there for older adults as far as preventing falling?
Yeah, there's lots of things that we can do. Number one, ask your doctor about all your medications and make sure that none of them have balance changes or gait dysfunction or low blood pressure as a side effect, and make sure that combinations of any medications don't contribute to that. By far and away, the most common class of medications that is associated with fall risk is any type of medication that works on your brain. So antidepressant, anti-anxiety, seizure medications. So be sure to ask your doc about them. Get your eyes checked regularly. Make sure you're wearing good footwear. And most importantly, stay active. Exercise and balance training are critical to maintaining good gait and preventing falls in our older adults.
So speaking of exercise and balance training, what is your take on Tai Chi and yoga for older adults?
There's actually a great amount of evidence on Tai Chi in the elderly. Big studies that geriatricians, base a lot of their recommendations on come from studies done on Tai Chi in Korean populations in California, done about 20 years ago. And what we've extrapolated is that any program that combines balance training first and foremost, and then some exercise training, has been shown to both reduce fall risk and the injuries related to falls. So I'm a huge proponent of Tai Chi. Yoga is also beneficial because not only does it focus on balance, but it also does a lot of strength training as well. People have looked at lots of different programs, whether it's balance, strength, agility, resistance training, high intensity training. As long as it has a component of balance and a component of just basic exercise, you're going to reduce your fall risk.
Many assisted living facilities require for their tenants to use their walkers. Why is this such a common practice now?
I don't know. I don't think there's regulations that stipulate that.
Okay.
I think facilities may err on the side of caution just to show that they've put forth an effort to reduce fall risk. It's important to note, though, that if someone's using an assistive device like a cane or a walker that wasn't specifically fitted for them and made for them, it can actually increase fall risk.
Wow.
So for example, say mom sees that dad had an old cane and she just grabs it out of the closet and she's walking around with a cane up here like this, that's actually going to increase fall risk.
Wow.
If someone doesn't learn how to properly use a cane, such that they're walking with it on the wrong side or with the wrong stride, you increase fall risk. So I would not go to the drugstore and just pick up a cane or walker if you think you need one. And I would caution those facilities to have everyone go through a formal physical therapy evaluation to determine if and what exact device they need.
Regarding falling, of course, there comes injuries. So what are some injuries that doctors really fear for patients who fall?
Well, in our older adults, there's probably two big ones that we're most concerned about. The first one is a fall leading to a hip fracture.
Okay.
The second one would be a fall leading to head trauma. In younger adults who have normal reflexes, the most common kind of trauma is a wrist fracture, because younger adults are able to get their hands up in time if they fall forward or backwards. So we usually see that. In older adults, where just normal changes of aging, our reflexes slow down, the hands usually don't get out in time. So individuals tend to land smack on their side,
right,
or hit their head first. That's why they're more common. I think the head trauma, for obvious reasons, we understand why that's something to be concerned about. The hip fracture, though, surprisingly, is associated with incredibly high level of premature death and morbidity. So, not to be scary, but the evidence shows that up to 50% of people who have a hip fracture after 1 year will not be able to regain their prior level of function. 25% of those people who fracture their hip will end up in a long-term care facility or institution after a hip fracture. And the increased risk of premature death after a fall leading to a hip fracture goes up 3 to 5 times. So doing all these things we can to prevent falls, which we're so worried about leading to hip fractures, are really something we focus on in geriatrics. In addition to doing exercise and balance training to prevent that, some studies show that taking vitamin D, regardless of level, can be useful in preventing fall risk. Most people say around 1,000 units a day of vitamin D has been shown to minimize that risk.
Thank you so much for sharing this great information.
My pleasure.
Be sure to watch more episodes on this topic and other issues of interest to all patients here on Aging Gracefully. We will see you next time.